solution by mixing 1 part 5% chlorine bleach to 9 parts water to make 0.5 chlorine solution. Change chlorine solution at the beginning of each day or whenever solution is very contaminated or cloudy. Ensure that the mother is in her position of choice while in labor. Ask mother if she wishes to eat or drink or void. Communicate with the mother, inform her of progress of labor, give reassurance and encouragement. Next is check the temperature in DR area to be 25 to 28 degrees. Eliminate air drop. Ask woman if she is comfortable in semi-upright position. The semi-upright position is the default position of the delivery table. Ensure the woman's privacy. Okay, ma'am, are you comfortable with your position? Okay. Remove all jewelry, then wash hands thoroughly, observing WHO 1, 2, 3, 4, 5 procedure. So after cleaning my hands, prepare a clear, clean newborn resuscitation area. Check if the equipment is clean, functional, and within the easy reach. Arrange all the materials or supplies in a linear sequence. 2 sterile gloves, 2 pieces dry linen, a bonnet, oxytocin injection, a plastic clamp, instrument clamp and scissors, and 2 kidney basics. In separate sequence for after the first breastfeed, we need eye ointment, stethoscope to symbolize the PE, vitamin K, hepatitis B vaccine, BCG vaccine, and cotton balls for injection. The perineum with antiseptic solution. Next is wash hands and put on 2 pairs of sterile gloves aseptically. At the time of the delivery, encourage the woman to push as desired. Okay, ma'am, just inhale and then exhale and then push. Inhale, exhale, and then push. Okay? Drape the clean dry linen over the mother's abdomen or arms in preparation for drying the baby. Apply perineal support and do control delivery of the head. Okay, ma'am, just inhale, exhale, and then push. Inhale, exhale, and then push. Okay. Call out time and sex of the baby. Inform the mother of the outcome. Okay, the call out time is 12 p.m. and mom, you have a baby girl. On the first 30 seconds, thoroughly dry the baby for at least 30 seconds, starting from the face and the head, up to the trunk and the extremities while performing a quick check for breathing. In 1 to 3 minutes, remove the wet cloth linen and place the baby in skin-to-skin contact on the mother's abdomen or chest. And then, cover the baby with dry cloth and baby's head with a bonnet. Exclude a second baby by palpating the abdomen in preparation for giving oxytocin. Use wet cloth to wipe the soiled gloves. Give IM oxytocin within 1 minute of baby's birth. Dispose of wet cloth properly. Remove the first set of gloves and decontaminate them properly in 0.5 chloride solution for at least 10 minutes. Next is palpate the umbilical cord to check for pulsation. after palpation stops, clamp the cord using the plastic clamp or cord tied 2 cm from the base. Place the instrument clamp 5 cm from the base and then cut near the plastic clamp, not in the midway. Perform the remaining steps of the AMESL. Wait for the strong uterine contractions and then apply the controlled cord traction and counter traction on the uterus, continuing until placenta is delivered, and then massage the uterus until it is firm. Inspect the lower vagina and perineum for lacerations or tears and prepare lacerations or tears. Examine the placenta for completeness and abnormalities. Clean the mother, flush perineum, and apply perineal napkin or pad. Check the baby's color and breathing. And then check that mother is comfortable, uterus is contracted. Are you comfortable, ma'am? Okay. Dispose the placenta in a leak-proof container or plastic bag. Decontaminate, soak in 0.5% chlorine solution the instruments before cleaning, and decontaminate the second pair of gloves before disposal, stating that the contamination lasts for at least 10 minutes. Advise the mother to maintain skin-to-skin contact. Okay, ma'am, you should maintain the skin-to-skin contact to your baby. And the baby should be prone on the mother's chest. On the mother's chest between the breasts with head turned to one side. In 15 to 90 minutes, advise the mother to observe for feeding cues. So the feeding cues are mouth opening, lip licking and sucking, and bringing hands to the mouth, and moving the head as if looking for the mother's nipple, clenching of fists and fingers over the tummy, and bending of arms and legs, and fussiness. Next is support the mother, instruct her on positioning and attachment. Wait for the full breastfeed to be completed. After a complete breastfeed, administer eye ointment This is to prevent the newborn from a gonorrhea if the mother had. Next is do a thorough physical examination. Administer vitamin K to prevent low levels of vitamin K and vitamin K deficiency bleeding. So, vitamin K 0.5 ml IM in the vastus lateralis or in the right leg of the baby. Next is administer hepatitis B to protect the baby as early as possible from any exposure to the hepatitis B virus. Hepatitis B vaccine 0.5 ml IM vastus lateralis or in the right leg of the baby. Next is administer BCG injections to protect the baby from serious form of tuberculosis such as meningitis and miliary TB. So we will administer this intradermally at the arm of the baby. Advise the mother on optional or delayed bathing of the baby, so it is recommended after 6 hours and the breastfeeding per the month. In the first hour, check the baby's breathing and color, mother's vital signs, and massage the uterus every 15 minutes. In the second hour, check the baby mother dyad, every 30 minutes to 1 hour. And then, complete all the records.